Cardiovascular risk reduction with Icosapent Ethyl for hypertrigliceridemia. Definition: Icosapent Ethyl is in a class of medications called antilipemic or lipid regulation agents. It reduces triglyceride levels and is used as a dietary supplement in adult patients who have triglyceride levels of at least 500 milligrams per deciliter. In addition, icosapent may have anti-inflammatory, antioxidant plate stabilizing, and membrane stabilizing properties.
It was my privilege to just present the main results of the REDUCE-IT trial. REDUCE-IT randomized over 8,000 patients with elevated triglycerides in a range of 150 to 500, in fact it ended up being 135 to 500, who also had either secondary prevention type indications, namely stable coronary artery disease, cerebrovascular disease, or peripheral artery disease, or what we call the primary prevention cohort that was actually patients with diabetes and at least one additional cardiovascular risk factor. Such patients were randomized to receive either Icosapent Ethyl, a highly purified version of EPA or icosapentanoic acid, versus placebo. The dose of Icosapent Ethyl that was used was 4 grams per day. That's a prescription medicine that's sometimes used for people with really high triglycerides. We studied patients in a triglyceride range below which the drug is actually approved for use. And what we found in our overall study of patients who were well treated with statins, average LDL cholesterol of 75, was a significant 25% reduction in cardiovascular events, including a 26% reduction in cardiovascular death, myocardial infarction, or stroke, including as well a 20% reduction in dying from cardiovascular causes. So the trial was very positive in terms of its primary and key secondary endpoints, as well as different components of those endpoints. So overall, I think a trial that should hopefully be practice-changing in patients of the sort that I just described. And I think the type of patient that I described is pretty generalizable. In the trial, we ended up randomizing 43% of the patients we screened. So I think this is something that will be highly relevant to cardiologists, endocrinologists, and primary care physicians. I'll point out again, this is a prescription medication. It's very different from over-the-counter supplements. So I wouldn't extrapolate these results at all to over-the-counter supplements. In terms of safety and tolerability, it was as well tolerated as placebo. We did see a small excess in atrial fibrillation that was significant with Icosapent Ethyl, but on the other hand, there was a 28% reduction in stroke with Icosapent Ethyl versus placebo, so that is quite reassuring in that regard. And there was a trend, albeit not statistically significant, to more serious bleeding with Icosapent Ethyl versus placebo, though no excess in bleeding into the brain or into the gut or any fatal bleeding. So overall, it seems to be, to me, a major advance in cardiovascular prevention, perhaps akin to the breakthrough when statins first entered the cardiovascular prevention scene.
Application in medicine. In physical therapy, information to the patient about his illness and aspects related to it, recognize drug index alterations, and control of vital signs.
The REDUCE-IT trial, presented here at AHA sessions in 2018, looked at high-dose omega-3 fatty acid supplementation on top of statin therapy in patients with cardiovascular disease or with high risk for cardiovascular disease and having triglycerides in the range of 150 to 500 milligrams per deciliter, so moderately elevated triglycerides. In this trial of 8,000 patients, they actually assessed high-dose pure EPA, that's icosapentanoic acid, therapy on top of statins to see whether that would reduce cardiovascular events. What they found over approximately a 5-year trial was a 25% reduction in cardiovascular disease event rates and a borderline significant reduction in total mortality of interest. This is one of the first trials that's looked at high-dose pure EPA on top of statin therapy in patients at high risk for cardiovascular disease and certainly one of the most positive using any type of omega-3 fatty acid. I think this opens the debate again about whether is it just the EPA and is it just the high dose that will matter for reducing cardiovascular disease events. I think this is a very well done trial. We need to worry a little bit about some of the adverse effects. There was excess atrial fibrillation, for example, but that was more than swamped by the beneficial effect, showing a 5% absolute risk reduction over the 5 years of the trial, with a number needed to treat of about 20 patients over 5 years to prevent one major cardiovascular event. So a very interesting trial, and I think this reopens the debate about fish oil on top of statins, but it looks like it needs to be higher dose and perhaps purer forms of omega-3 fatty acids.
Pros and cons.
The hard work you put into lowering your very high triglycerides with diet and exercise deserves the hard work that went into the science behind Vascepa. Prescription Vascepa. Vascepa, along with diet and exercise, has proven results in multiple clinical trials. Vascepa looks different because it is different. Over a decade of extensive research and development achieved proven results. That's the prescription power of Vascepa.
Vascepa is not right for everyone. Do not take Vascepa if you are allergic to Icosapent Ethyl or any inactive ingredient in Vascepa. Tell your doctor if you are allergic to fish, have liver problems, or other medical conditions, and about any medications you take, especially those that may affect blood clotting. 2.3% of patients reported joint pain.
Ask your doctor about what the science behind prescription Vascepa can mean to you. Amarin thanks the clinicians and patients who participated in the Vascepa clinical trials.
Pros. It is used together with lifestyle change, diet, weight loss, exercise to reduce the amount of triglyceride. Icosapent is only part of treatment program that can also include diet, exercise, and weight loss control. It can interact with other medications you take. Cons: joint pain and sore throat, vomiting and constipation. It is unknown if it is safe and effective in children. Issue in Ecuador. The result has been demonstrated Icosapent has implications for patients' health, significantly reducing by 2,500% the risk of heart attack and also stroke.
After Dr. Mark Polner suffered a heart attack more than 20 years ago, preventing another became a priority.
It's the key to life. I mean, if you don't have a good heart, it limits your whole lifestyle.
Now, a new study presented today at the American Heart Association's annual meeting and published in the New England Journal of Medicine is finding that a prescription drug made of pure fish oil could significantly reduce the risk of a heart attack.
I think it's the biggest development in cardiovascular prevention since statins were introduced.
Researchers looked at more than 8,000 patients who had elevated levels of fat in the blood called triglycerides and were taking a statin to lower cholesterol. They found those who also took the daily prescription fish oil drug called Vascepa lowered the risk of having a cardiovascular event by 25%. The risk of death dropped 20%.
I think that this trial and its findings hopefully will be immediately practice-changing and useful for patients, but beyond that, I think will spawn a whole line of scientific research trying to figure out how did this drug work.
The drug is FDA approved and costs $278 a month. Side effects include a low risk of internal bleeding. But for Dr. Mark Polner, who's been taking the drug for the last 5 months, he now has more peace of mind.
Hopefully it will keep me going for the next 30 years.
Dr. Torres, is this a fish oil you can buy at the vitamin aisle at a bodega or a pharmacy?
No, it's very different. These results don't apply to over-the-counter fish oil supplements. They contain a very different form of fish oil. This capsule does contain omega-3s, but it's highly purified, and it does require a prescription.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.
Conclusion: the risk of cardiovascular events will be lower with therapy with Icosapent in patients whom elevated triglyceride levels serve as a residual risk marker despite the same therapy.
Elevated triglycerides are an independent marker of increased ischemic risk. Icosapent ethyl, a highly purified and stable EPA ethyl ester derived from fish oil, lowers triglyceride levels. However, it's not known whether it reduces ischemic events. In this multi-center randomized double-blind placebo-controlled trial, 8,179 statin-treated adults with persistently elevated triglycerides and established cardiovascular disease or diabetes, and at least one additional cardiovascular risk factor, were randomized to 2 grams of Icosapent ethyl twice daily or to placebo. The primary outcome was a composite of cardiovascular death, non-fatal myocardial infarction, non-fatal stroke, coronary revascularization, or unstable angina. The key secondary outcome was a composite of cardiovascular death, non-fatal myocardial infarction, or non-fatal stroke. After a median follow-up of 4.9 years, the primary outcome occurred in significantly fewer patients in the Icosapent ethyl group than in the placebo group. The key secondary outcome also occurred in significantly fewer patients in the Icosapent ethyl group than in the placebo group. Hospitalization for atrial fibrillation and flutter was more common with Icosapent ethyl. Serious bleeding was slightly but not significantly more frequent in the Icosapent ethyl group. The authors conclude that in patients with elevated triglycerides despite statin therapy, Icosapent ethyl significantly reduces the risk of ischemic events. Full trial results are available at nejm.org.